Welcome to the Purdue Global Academic Success Center's presentation on respiratory alkalosis. The blood is made up of acids and bases. The amount of acids and bases in the blood can be measured on a pH scale. It's important to maintain the correct balance between acids and bases. Even a slight change can cause health problems. Normally, the blood should have a slightly higher amount of bases than acids. Alkalosis occurs when the body has too many bases. It can occur due to decreased blood levels of carbon dioxide. It can also occur due to increased levels of bicarbonate, which is a weak base. This condition may also be related to other underlying health issues, such as low potassium, also known as hypokalemia, and the earlier it's detected and treated, the better the outcome is. There are four main types of alkalosis: respiratory alkalosis, metabolic alkalosis, hypochloremic alkalosis, and hypokalemic alkalosis. Respiratory alkalosis is a medical condition in which increased respiration elevates the blood pH beyond the normal range of 7.3 to 7.5, with a concurrent reduction in arterial levels of carbon dioxide. This condition is one of four primary disturbances of acid-base homeostasis. This condition occurs when the blood doesn't have enough carbon dioxide, hypocapnia. The body releases carbon dioxide when we exhale. When we breathe faster, the lower carbon dioxide level in our blood can lead to respiratory alkalosis. Respiratory alkalosis is usually caused by overbreathing, called hyperventilation, that occurs when we breathe very deeply or very rapidly. Respiratory alkalosis may be produced as a result of any of the following causes: stress, pulmonary disorder, thermal insult, high altitude areas, salicylate poisoning, aspirin overdose, fever, hyperventilation due to heart disorder or other, including improper mechanical ventilation, vocal cord paralysis, compensation for loss of vocal volume results in overbreathing or breathlessness, and liver disease. Hyperventilation is typically the underlying cause of respiratory alkalosis. Hyperventilation is also known as overbreathing. Someone who is hyperventilating breathes very deeply or very rapidly. Panic attacks and anxiety are the most common causes of hyperventilation. However, they're not the only possible causes. Other causes include heart attacks, pain, drug use, asthma, fever, chronic obstructive pulmonary disease, infection, pulmonary embolism, or pregnancy. People who experience intense bouts of stress, anxiety, panic, or anger are at a higher risk for respiratory alkalosis. These conditions can lead to rapid, uncontrolled breathing, hyperventilation. People on breathing machines, mechanical ventilation, are also at risk. The machines deliver a fixed breath volume for each breath, which can lead to hyperventilation when patients need to breathe faster. As a critically ill person's medical needs change, they may need higher or lower levels of breathing assistance. Ongoing monitoring helps healthcare providers determine when to adjust ventilator settings. The mechanism of respiratory alkalosis generally occurs when some stimulus makes a person hyperventilate. The increased breathing produces increased alveolar respiration, expelling CO2 from the circulation. This alters the dynamic chemical equilibrium of carbon dioxide in the circulatory system. Circulating hydrogen ions and bicarbonate are shifted through the carbonic acid, H2CO3, intermediate, to make more CO2 via the enzyme carbonic anhydrase. This causes decreased circulation hydrogen ion concentration and increases pH, alkalosis. There are two types of respiratory alkalosis: chronic and acute, as a result of the 3 to 5 day delay in kidney compensation of the abnormality. Acute respiratory alkalosis occurs rapidly, have a high pH because the response of the kidneys is slow. Chronic respiratory alkalosis is a more long-standing condition. Here, one finds the kidneys have time to decrease the bicarbonate level. Alkalosis refers to the process due to which there is elevation of blood pH. Alkalemia refers to an arterial blood pH of greater than 7.45. Symptoms and signs depend on the rate and degree of fall in PCO2. Acute respiratory alkalosis causes lightheadedness, confusion, peripheral and circumaural paresthesia, cramps, and syncope. The mechanism is thought to be a change in cerebral blood flow and pH. Tachypnea or hyperpnea is often the only sign. Carpopedal spasm may occur in severe cases due to decreased levels of ionized calcium in the blood, driven inside cells in exchange for hydrogen ion H-. Chronic respiratory alkalosis is usually asymptomatic and has no distinctive signs. Other possibilities include asthma exacerbation, atrial fibrillation, atrial flutter, atrial tachycardia, bacterial pneumonia, bacterial sepsis, community-acquired pneumonia, COPD exacerbation, head trauma, heat stroke, hyperthyroidism and thyrotoxicosis, idiopathic pulmonary fibrosis, meningitis, metabolic acidosis, metabolic alkalosis, myocardial infarction, panic disorder, pneumothorax, pulmonary edema, pulmonary embolism, salicylate toxicity, theophylline toxicity, viral pneumonia. Treatment for respiratory alkalosis depends on the underlying cause to reduce hyperventilation. Treating the condition is a matter of raising carbon dioxide levels in the blood. Respiratory alkalosis is very rarely life-threatening, though pH levels should not be greater than 7.5. When PaCO2 is adjusted rapidly in individuals with chronic respiratory alkalosis, metabolic acidosis may occur. In anxious patients, anxiolytics may be necessary. In infectious diseases, antibiotics targeting sputum or blood cultures are appropriate. In embolic disease, anticoagulation is necessary. Ventilator support may be necessary for patients with acute respiratory failure, acute asthma, or acute chronic obstructive pulmonary disease, COPD, exacerbation if they show signs of respiratory fatigue. In ventilator-controlled patients, it may be necessary to reevaluate their ventilator settings to reduce respiratory rate. If hyperventilation is intentional, monitor the arterial or venous blood gas values closely. In severe cases, pH may be directly reduced using acidic agents. Prevention is a matter of addressing the cause of hyperventilation. The most common causes are psychological: stress, panic, and anxiety. You can adjust to and learn how to control these causes. Working with a therapist may help, so can breathing exercises, meditation, and regular exercise. Medication may also be needed in some cases. Good coping strategies for these types of issues are crucial. They can help lower the risk of hyperventilation and the resulting respiratory alkalosis. They can also help you function better overall in everyday life. Thanks.